Hi everybody, let's talk about safe sleep and SIDS. SIDS scares so many new moms and dads because obviously the term SIDS means sudden, and it's not necessarily something you can prevent. Now you can prevent it through certain things, and those certain things are, of course, back to sleep. We have the back to sleep campaign, right? Always put your baby on their back when you're putting them down to sleep. Now, of course, when they get to the point that they're rolling over, you want their bed, and you always want infants to have a bed that is empty from bumpers, loose things, blankets, stuffed animals. Do not put anything in their crib or bassinet. When you are swaddling in the newborn phase and they start to roll over, you need to remove a swaddle blanket and go for something that is like zip, so that when they roll, it rolls with them. And the peak age of SIDS is not newborn phase. It's actually 2 to 4 months, even stretching into that 6-month phase. So we can't just take a deep breath as they get out of that newborn little stage. We also have to be cognizant when we're breastfeeding our babies that we're not falling asleep with babies on our boob in the bed, because bed has what? It has pillows, it has blankets, it is often very soft. So we need to be able to put our baby back into a bassinet, co-sleeper, their crib. If you are dads, if you're pinch hitting for mom at night, please don't fall asleep with your baby on the chest. There have obviously been many instances of SIDS where dads fall asleep on the couch or a chair and roll into the cushions and have had a SIDS incident or a sudden unexpected infant death. We need to be very cognizant of, we are getting tired, we need to put the baby down in a safe place. Other things we can do to be preventative. Smoking is a known association with SIDS. We need to not wear anything on our clothing if we are smoked. If you are a smoker, then you need to have clothing that you change into when you smoke and take off after you've smoked. If you have long hair, pull it back so the baby isn't inhaling smoke. If you are a smoker and you are pregnant, that increases your risk of SIDS or sudden infant death syndrome later. We really need to work hard on stopping that habit during pregnancy, because that alone is a risk factor for SIDS. And I know this is not meant to be a painful reminder of weight, but obesity, medications that make you sleepy, these are increased risk of SIDS. Please do not sleep in the bed with your infants. I know that co-sleeping is something that many families do. I am not suggesting that as your children get older, that's not something you can do. I'm saying in the infant phase, I have seen babies pass away from SIDS due to sleeping in the bed with parents. So it is not safe, and I have seen the grief from parents when this has happened. I just want you to be aware that this is a risk factor. It has happened, and it's not something that you just don't do for the first 2 months of life. It's something that we continue to do all the way through 1 year of age, all the way through the first year of age. All of these recommendations, all the way through the first year of age. And then we can sort of talk about what we can do starting at 1 year old and older. Sudden infant death syndrome, sudden unexpected infant death syndrome. These are the things we're trying to prevent. Some of this information is unfortunately going to be taken away from you to be able to Google. I hope this video is helpful so that you can learn and be able to prevent what you can. And sometimes it's not preventable. Using an owlet or an oxygen monitor on your baby's foot is still not going to be something that necessarily can prevent, because those can sometimes read just shallow breathing. Just an FYI, in case that's something you have purchased and plan to use, it's not foolproof.